Welcome to Executive Insights. My guest today is Dr. Chandana Unnithan, Chief Security and Informatics Officer with Lifeguard Digital Health. In this episode, we discuss the role of technology in helping to protect us from another pandemic. Chandana sheds light on the parallel health crisis in Canada and explains how technology can help address mental health. We explore the progress and challenges with digital health adoption globally and what can be done to close the gap. Hi, Chandana. Good to see you. Welcome to Executive Insights.
Thank you, Nasheen, for inviting me and for this opportunity to have a chat. I'll look forward to your questions. Thank you.
Chandana, you have a PhD in digital health and informatics and have been involved in many important digital health initiatives on a global scale. You're also a member of the United Nations and the World Health Organization. In your expert view, how can digital health help to protect us from another pandemic? What can we do as a technology community to get there?
Thank you for that question, Nasheen. There is a lot out there, and there's much the technology community can do. I would like to focus on a couple of areas which are critical to today's pandemic, the way it is being addressed, as well as in the future. Awareness. Awareness is the most important thing technology community can help support the public health, health authorities in general, because there are various ways in which technology preserves the privacy of common citizens. At the same time, creating the awareness about a pandemic, how it is being addressed, what are the solutions out there. For example, if there is a vaccine and if it's reliable information which is being done, and so on. We tend to really trust our health authorities in the case of pandemics. At the same time, we also rely on a lot of peer support and peer information. For example, I would ask my peers, would you know what is happening out there? Would you know how far the pandemic is? What is the lockdown? What are the regulations? And so on. By having a privacy preserving approaches and over time building the trust in the users of the technology, there is much that we can create in terms of awareness and also building the trust amongst the citizens. So answering your second question, trust is an important factor. The more we build trust using technology and also get rid of the skepticism relating to new technologies by trialing them and bringing them closer to citizens by making it more simpler for users, that would be the best thing that the IT people can actually do. IT companies, the people who develop new technologies, it is important to have use cases and user experience and also bringing it closer to public.
Thank you. That's great recommendation. While COVID-19 has been dominating the headlines in the world since the beginning of last year, you mentioned to me last time we had a conversation that there are actually two health crises in Canada. Can you elaborate?
At this point of time, we are talking about British Columbia, where we are located, and everyone is aware of the opioid crisis, which was declared as a public health emergency in 2016 in Canada. To an extent, there's been many approaches to harm reduction and prevention of this crisis, many of them in different ways using technology. Lifeguard Digital Health is supporting the health services as a B2B solution SaaS company that provides a public health related user driven solution. So the opioid crisis was the first crisis that was already in place as a public health emergency when COVID occurred last year in March. This really resulted in a twin crisis, as we would call it. And in British Columbia, as the statistics would indicate, there is more deaths from the opioid crisis during the pandemic than the COVID related deaths. So the reason for this is that the COVID pandemic resulted in lockdowns. There were measures taken for people to stay at home. And during that time, there were many overdoses experienced. There was a surge in the opioid crisis. So this resulted in having a twin crisis. The twin crisis was much more severe in Canada than just the COVID itself. And we were at the forefront of this, trying to use a software as a solution, kind of user-driven application to support the health services, as where our health services were also quite strained by the pandemic because the focus was more on protecting the people, and all the services were stretched to the maximum during COVID. And there were many times there were overdose prevention centers, and those contact centers had to be removed, and because we needed to find contacting solutions to protect the health services workers themselves. Altogether, when people are away and not talking to their peers, and there is a lack of support from your peer support groups, human beings being social beings, this has really led to the surge of the opioid crisis much more than COVID, particularly in British Columbia.
Wow, that is quite concerning what you just described there and alarming as well. One of the initiatives you're undertaking as the Chief Security and Informatics Officer with Lifeguard Digital Health is to fight opioid crisis with the application of technology. Sadly, the increased incidences in drug overdose have a direct correlation with the state of mental health that's only worsened by the pandemic. What is the role of technology in addressing mental health?
Thank you, Nasheen. The way in which this works is all connected to each other. There are many tools and approaches that are being used to prevent opioid crisis and opioid related overdose deaths already in the toolbox. Lifeguard Digital Health has come up with a technology solution which is completely user driven as an approach. The way in which we foresee it, or I would say in the forefront, is we should really work together with different parts of the health services, including the CDC, the Health Canada, health services authorities, and all the provinces as a country, or in any geographical location where this crisis is evident, to really work out what is really the root cause and how can we prevent it before it occurs. So there is a direct correlation between technology and mental health in this case, because as we all know, many of our meetings, many of our interactions have gone online. And the technology has brought our peer support system to our living rooms. And this is a very important factor. And connecting this into the public services or the services that support citizens in a healthy nation is very important. And there are many small technologies that are being trialed, which are able to simply be used. It is those technologies that exist are already being used, say, for example, in artificial intelligence. Think about your Uber, the way in which you can actually see who's coming to your house throughout, you're actually tracking that. Similarly, it's very simple methods that can be tracked. When it comes to health, people are reluctant to do that because they do not want their information to be passed on to anyone. But if we know that the awareness is created that you're not on in this alone, everyone is in it together, and the more we see it that way, there will be uptake of technology approaches that can further support us. Canada is well positioned because there are a lot of technology oriented companies. There is trials that is being done. There is a chance to leapfrog these technologies for the domestic economy quite well. It's well positioned. It is just a lack of awareness and the trust in the way in which the technology can be used. And also, we're all grappling with the idea of how can we regulate the technology itself and how can we protect citizens in the right manner. It's different for different geographic locations in different countries. It is about the more the awareness is, the trust builds within the technology and the system.
Yeah, awareness and trust, two most of the important factors in the digital health adoption, definitely. Chandana, you are originally from Australia, where the electronic health record was implemented in the entire country in 2019. As a driving force behind this initiative, you poured over a decade worth of work into this initiative. It's interesting because when you and I had a conversation recently, you mentioned up until most recently, you were still seeing a doctor in Australia. Why is that?
Rasheen, as I mentioned before, trust is a big factor. I'm used to a system where everything is interconnected. So my doctor would actually know my history and all throughout by pulling up the records, what I have done. And based on that information, that person, the physician, is able to give me a correct diagnosis. To have that kind of a system, which is based on technology and the electronic health records for every citizen that connects all the records, it is very useful. And for me, the trust in the system has been the most important factor. Apart from the fact that, yes, we do have to physically, or, resort to another health service provider or anyone virtually, the comfort of seeing the same person virtually over time in the comfort of your living room is very important. It is more the trust in the system and the ability, the ease in which it has been used and how it seamlessly works that gave me the confidence and continues to be so.
Yeah, I can appreciate that. uh, when you and I discussed about digital health innovation and adoption earlier, that you mentioned the pace of adoption is varied globally, even though the pandemic has accelerated the progress. There still may be a gap in years in terms of digital health acceptance and adoption, depending on where it is. So, what can be done to close the gap?
There is definitely a gap, and this would really depend on different countries and the way they see the system. So, every country and every geographical location has some benefits and also some disadvantages or challenges, as I would call it. So, in Australia, being a unique position in the geography of the world, where we need to look at domestic solutions first, where we need to protect the country because of the geographic isolation, we tend to look at technologies in a positive manner, and majority of the people actually look up to it, and we adapt or adopt the technology quite quickly. And it's also the governance system at times when you have a governance system which is central or federally driven. Sometimes that is a good thing. Every geographic location, as I would call it, has their own challenges. Sometimes it's infrastructure, sometimes it's regulatory, sometimes it is the governance systems. There is the pace, and sometimes it is the technology itself. In some countries, there is a unique position where you can leapfrog into the new technologies because the previous technology did not exist. So, in some countries in the world, if you think about mobile phones, the mobile infrastructure made that whole telecommunications possible. where the fixed line telephony did not exist, going backwards in some decades. So similarly, if you do not have a legacy technology behind, and you're taking a new technology as a fresh new person as of today, it makes it easier. Otherwise, the legacy has to be completely removed first, or moved in or phased out and moved into a new technology. That also changes, the gap becomes more because it takes time for our legacy to completely move to a new technology. It is always easier to put in a new technology fresh rather than moving it all together in there. But none of the geographically, none of the nations are in a position where you can just plug in a new technology and do not have a legacy. So, depending on the legacy systems that need to be removed, we go into newer systems. Then there is the regulation and also the acceptance within a society. That is the reason why there is a disparity between different nations in the adaptation of technology. And going back to my first point, it is lack of awareness most of the time. We all look to other countries, but we tend to forget that these technologies, or these are what we are looking at, can be used productively within our own environment.
Very well said. Thank you, Chandana, for your time and for your wealth of information and recommendation.
Thank you again for this opportunity.
You've been watching another episode of Executive Insights by the IT Media Group. Thank you for tuning in. If you like this video, please check out other CIO-centric content on our YouTube channel. And don't forget to subscribe